Hello, Zoila.
Hi, Chantel. How are you?
I'm very good. How are you?
Doing okay, doing great.
It's so good to see you.
Yeah,
Uh,
finally, we get to meet each other face to face.
exactly, exactly. So I wanted to, well, we'll start from the very beginning. Uh,
Okay.
just tell us your name and where you're from originally.
Sure. So my name is Zoila Thaliffdeen. I'm was born in Lima, Peru, and moved to California in 1990 after finishing my schooling back home, which was I have a degree in pharmacy and biochemistry. So I've been working for a hospital here in Orange County as a clinical pharmacist for many years, ever since I came. Yeah.
Oh my goodness. How did you find reflexology? How many years ago? When did that begin for you?
Well, a few years ago, uh, well, I've always been interested in complementary therapies, even before I moved here, like study herbs, essential oils, and anything that could help uh, keep our health, longer with simple means. And several years ago, about 2017 or 18, I discovered Reiki,
Mm.
and that changed the world for me. So the energetic healing modalities opened up for me, and I saw myself for the first time as someone that could bring relief to others and to myself. And then years later, my brother, a Catholic priest who was working at the time in Lima, Peru, told me about a reflexology center back home that he attended regularly. So he told me the next time you go to visit Lima, don't forget to stop by there. It's wonderful. So I made it a point the next time I went in 2021 to make an appointment with my husband for a treatment. Now, I had never had a reflexology session before uh, anywhere. And I was surprised that that night my husband slept soundly the whole night. And he's the type of person that wakes up 4 or 5 times a night. And we both were impressed by how helpful that was. So we said, well, before we go back, we'll do another session. And we did another session. Now, the world of reflexology back home in Peru is different than the world of reflexology here. And I had no idea how it would be so different or anything because I had never had a reflexology treatment here. So when I came back, I really wanted to learn this to help my husband.
Mm.
So my brother arranged it so that I went back home again for a week and I attended a series of 6 days of 5 hours a day of training. But the practice of reflexology back home is, at least by the institute that I attended, uh, I took classes informally from a couple of practitioners that had many years of experience, and they follow the system of the traditional Chinese medicine with the elements and everything. So that was a new world to me. And before even coming, I said, I need to find out how is reflexology practiced in the States. So I found out on Facebook a group, the World Reflexology Foundation, I think it's called,
Mm.
and it's like an 8,000 member group. So I felt instantly accepted in a very, very large community. And I discovered that reflexology meant so much more. And there were so many branches on so many new ways of doing it, and people always learning new ways and teaching new ways. And then I found out that this was an endless, way, endless source of opportunities to learning things. And I really, really liked it. And I liked the reflexologists. The professionals that practice reflexologists, to me, are people that are continuously learning, are giving, are generous, are dedicated, and super smart. So I said, I want to be one of those people. So I started to practice. I took classes online here and there, and then when I came here, the first thing I said is, I need to go to a reflexologist here. So I asking that web in that reflexology Facebook page if there was anyone there that lived in Southern California. And Patty Mayers in Laguna Hills responded. So she told me she could come to my house to give me a session, and she did. And I was surprised to find out that the session was different than what I received back home. Back home was deep and it was more painful. And here it was more relaxing, more pleasurable for me, and I think also for the practitioner.
Mm.
Now, there's another piece that is very different, or I thought it was super different. Back home, the institute where I went is a building of 3 stories, and there's like 12, 15 practitioners at any given time that, is in different, they're located in different rooms. But because it's run by and founded by a nun, they had at the beginning of the day, they pray, they sing a song, a Catholic song, and they go about their treatments. They do a prayer with the recipient before they start the treatment. So it's a different connection.
Yeah.
It's a little different piece there in the session. And even my brother, who is a priest, told me, Zoila, before you start the session, you should pray with it. I've lost that habit. I've done it when I know the person is receiving it follows the same faith, but otherwise I don't do it. Anyway, so that was another thing that I noticed it was different. Also, the cost of a session back home is like equivalent of $10. Back it was like in 2021. So it's more like accessible to more people. Some people that sometimes cannot afford medicines can afford a reflexology treatment. And that's a difference between, I think, the how easy it is to access the treatment back home versus here. So anyway, so I had my treatment with my colleague Patty Myers here, and we kept the friendship. And after a couple of years, she told me, Zoila, you should get certified. So then I contacted you once, and I started to check for reflexology associations or institutes or something, and I came across the International Institute of Reflexology and Bobbie Warren. So I attended her classes in San Diego and finally became certified on October 2023. So far it's been a great experience for me because I studied some of the like reflexology for pregnancy from Mauricio Kruchik. I've done the reflexology, the top 1 class for pain from him also. I studied with Sally Kay, the reflexology for lymph drainage, and I love it. And
Yes.
then, so you see that reflexology can be practiced in different ways, and it amazes me the results that you can get, even not going that deep, and the relaxation goes a long way. So
Yes.
yeah, so that's what I've been doing. And
Unbelievable.
now I have this room here is a little studio I have in my house.
Yeah.
So I see patients here for both Reiki or reflexology, and sometimes for both. So I do Reiki first and then proceed with reflexology, and it depends on the complaints they come with, right? That I could think maybe I decide that it's better to do Reiki first, or.
Yeah.
Mhm.
It's
Yeah,
so wonderful. I love that piece that you're bringing up of, it is practiced differently all over the world, although it is practiced all over the world.
yeah,
Is there, and I love that combination, we have this in common, that combination of the Reiki and the reflexology. Do you find there's a certain client that you tend to attract, or is there a certain method you end up using more than something else?
yeah. Well, you know what? Because I work as a clinical pharmacist full time, I don't dedicate a lot of time to this practice. I have a website, and I have people that have contacted me because they look for a practitioner in the area, and there's not that many that show up on like the International Institute of Reflexology website or the RAC website. So that's how people find me, or friends of the family, or co-workers might find me. Um, no, I don't think there's a particular type of client that I tend to gravitate to, or that gravitates to me. Yeah.
Yeah, this is so wonderful. It's so, I mean, this is our first real conversation about this, and it's so great to hear you talk and to know more about you and what you do. And yeah,
Yeah, I
so,
think this is again is something that accompanies me everywhere I go. Like when I travel overseas and I'm going to visit a relative or a friend, this is something that I offer. Even if I have a few minutes, can I have your hand? And I do hand reflexology or foot reflexology, and it's nice to introduce someone to this world that sometimes they wouldn't had seen, or I don't know. There's so many people that have never ever, like me a few years ago, experienced this. And yeah, that's great. And it's
oh,
great what you're doing because we want to pass the word. We want to,
yeah,
tell the world that there's a therapy that is non-invasive, that can help you, relax and bring you back into balance, and you just need the hands wherever you go. And that's what I've done.
absolutely. I love to what you said about like in other countries it tends to be deeper, and this idea and
At
belief.
least that's what I experienced. And I
Yeah,
don't know how it's practiced, let's say in Argentina or Uruguay, where there's huge amounts of reflexologists and they practice in hospitals. It's a very well-known therapy there. And I cannot talk for them. I just can
yeah.
talk about how I was practicing at the institute that I attended, you know.
Let's go to Argentina together.
That'd be awesome.
Yeah. Yeah. Well, and also it makes me think about, I always think that so many people find reflexology either in their like third or fourth careers or when they're retired, and that the way we do it in this country, we really can do it until we die. Like really a practice, right? That we can do. It's so easeful, right? Not
Yeah, yeah.
for our bodies, for our hands. Yeah.
Mhm.
Yeah. Is there um is there anything you wish to share about reflexology or what it has meant to you or any maybe experience you've had in giving reflexology that was really meaningful for you?
Yes, and I hope it's okay to share that during COVID, there's many practitioners that discovered that they could do reflexology at a distance.
Mhm.
And as a Reiki practitioner, I've been fortunate to do it. Like I treated a niece that was pregnant in Dubai over her pregnancy, over two of her pregnancies. And it was a joy and a pleasure to connect with her, all, by doing reflexology at a distance, using my husband's feet as a surrogate. And yeah, that's something, a combination that I do 10 minutes of Reiki and then reflexology, and it's been super effective for pain, especially if I find that if the injury or the issue is recent, it's easier for me to give relief than if it's a deep-seated problem that the client might have suffered with for 2 3 years. That sometimes it tends to take
Yeah,
more sessions,
yeah,
but I just love to explore. That is amazing that can happen, right? And you can verify the effectiveness of the treatment by talking to the recipient later and verifying that the points that you discover that were congested match whatever the illness is that the person or issue the person might have.
yeah.
That's something else. Never ceased to
Incredible.
amaze me. Mhm.
That's amazing. And you said that you use your husband's feet as a surrogate, and I know in Reiki too. I know with my initial training, you could use like a stuffed animal, you could use your own hands or thighs. Like there's that. Can you also, because I don't send reflexology at a distance. Can you do it without a surrogate? Can you do it in your mind's eye? Or yeah.
There's people that do it, yeah, but there's people that do it, like I forget the names right now, forget, but this lady in Europe, and her name I can't remember, but she does this on her feet with the intention that goes to the recipient. I think she uses the person's photo, maybe, I can't remember, but it's possible for you to do it without having the feet of somebody as a surrogate. So she does it that way.
Spain.
Mhm.
So beautiful. Yeah. Ooh, I like that. I want to know more about that. Yeah, that's not a, I remember that very well with COVID. And that's such an interesting, yeah, and it was so important during COVID, but right now too, right? There's so many people with Reiki, it's so effective at a distance. I can only imagine with that extra intention and with the knowledge of that reflexology map. So cool.
Mhm.
Yeah.
Yeah.
Well, this was really fun. Is there anything else you would like to say before we close?
Well, I'm looking forward to moving along in my life using reflexology, like for my family. My son got married last Saturday. My other son is getting married next month, and I'm looking forward treating my daughters-in-law with reflexology during their pregnancy, to the babies on their little feet, and and taking reflexology anywhere I go, and to see patients, clients. I cannot say patients, clients at home or wherever I go. I
Yeah,
love it. I love it, and it's never ending, never finish learning, because it seems that there's always something new there that I find out that it's being taught, and yeah.
absolutely.
Mhm.
Well, Soila, it's so good to see you. I'm so glad we did this.
I'm so glad too, because we can relate. You're a Reiki
Yeah,
master, I'm a Reiki master, and we have so much in common. Yeah, thank you for your service to the association. We value it. You're making it stronger and better. I'm so glad I follow the advice of my teacher that told me you should enroll, to the whole class. If you choose one association to belong to, enroll to on the association of your state so you can support that association.
yeah.
It makes a lot of sense.
Oh
Mhm.
my gosh, totally. Yeah, and there's something about, yeah, we have such a good association and such great yeah, we really have a lot of energy in our association. There's yeah, so much support and connectivity there. Yeah. Oh, thank you so much.
You're
Uh,
welcome.
we're not done yet. We'll talk later.
Ah,
Yeah. Anyway, thank you so, so, so much.
thank you.
Mhm.